Good morning, everyone. This is Purvi Parwani with Fits on the Go blog at ACC 2016. I am joined by Dr. Rick Nishimura today, who is an expert in clinical education. Dr. Nishimura, tell us about role of education in a fellow's life, and how do you go about it when you become attending or a clinical cardiologist later on?
Okay, so huge topic. But here's what I would say is that as a fellow, there's actually several areas you should think about. One of them is your kind of basic fund of knowledge. And your job as a fellow is to kind of learn that throughout all of the different areas and different subspecialties. And with that, you're going to have to use some type of products, such as ACSAP, such as the ACC board review, Mayo board review, but get this underlying foundation of knowledge. So that's essential, and you'll need that to pass the boards. But I think in addition to that, at least as a fellow, you're going to have to use the opportunities that you have to be able to take this knowledge and apply it to patient care. Um, and I think nowadays with the web, with everything that you can do on your iPad, you can easily get little bites of knowledge. You can go to the guidelines, you can look up things. But what you have to learn as a fellow is how to apply that to an individual patient. You can only do that by seeing a lot of patients
Yeah.
and by taking the master clinicians or the people that you know are practicing excellent medicine and having them help you apply this to patient care. So I think what you have to do is get your underlying body of knowledge, and then every patient you see, you want to go out and grab the new knowledge that has come up. But as a fellow, the advantage that you have is you can then use the experience of these professors who have years and years of taking care of patients, and at your institution, our institution, every institution, there's a large number of them, and then use them to show you how to individually apply this to every individual patient. Because Blaise Carabello and I have written a little paper about this, and we actually said that if you follow the guidelines 100% of the time, you're not doing your job. So you have to be able to know the exceptions and how to apply it. And then once you graduate, it gets even more complex because you're going to have to be keeping up with all of the new trials that are coming out and how to apply them to patients, and you have to take advantage of the things that the ACC has. These meetings here, acc.org, the ACSAP products, they've already taken all of this data that's been synthesized, and the beauty of the college is that you've got all of the experts in the field who are able to synthesize all of this data coming in and then spit it out for you as a practicing cardiologist of what you should do and what you shouldn't do. And you really need that society, that professional society, or your old university or where you trained to be able to get that information. So I think overall it's a little different once you graduate, but in your graduation, but before you graduate, I would urge you, build that fund of knowledge. But on top of that fund of knowledge, use the opportunities that you have at your training program with these kind of esteemed master clinicians to teach you how to apply that knowledge to patient care, which means you're going to have to see a lot of patients. You're going to have to grab these people and say, come help me, but I think that's very important.
Okay. I actually have one more question. What kind of system do you have? Like, how do you keep yourself up to date? Do you read every day, or how do you keep up with all the knowledge that is out there and the new research that's coming up?
So that's difficult, and nobody can keep up with everything. So I think what the college has developed is that's what maintenance of certification is about. And what they've done is they've written a number of MOC questions that are focused on all of the up-to-date material, and you can test yourself. You can test your gaps in knowledge on those, and the things you don't know, you then have to go ahead. But I think one last important thing that is important as a fellow, as well as when you are a practicing cardiologist is the concept of reflection. Now, reflection is something that the educators say, but nobody ever really takes seriously. But what you really need to do is after every day or after every week that you've been in the lab or been seeing patients, you should take some time and write down what you've learned, what you've done wrong, what you've done well, and by doing that and by taking the time, you're going to be able to retain much, much more. So I would urge you now in the fellowship and when you go, take that, half hour a day or an hour at the end of the week and do the reflection.
That's such a great advice. Thank you so much for joining us today. For more videos like this, please go on youtube.com, Fits on the Go blog. Thank you.